All right, today we're talking about a drug that absolutely changed the game in the fight against cancer. It's called Ipilimumab. And its story, well, it's not just about a new pill or an infusion. It's about a completely different way of thinking about how we take on this disease.
It all really starts with this one simple question. What if the most powerful weapon against cancer wasn't something we had to invent from scratch, but something that was already hiding inside every single one of us? I'm talking about our own immune system. That's the idea that changed everything. You know, to really get how big a deal this was, you have to rewind the clock to before 2011. If you were diagnosed with advanced melanoma back then, honestly, it was a pretty bleak situation. The treatments we had were limited, the prognosis wasn't good, and everyone was desperate for anything new.
And this slide really shows the massive shift in strategy. So think about traditional chemotherapy. It's kind of like a carpet bomb. It just attacks any cell that's growing fast. And yeah, that includes cancer, but it also includes a lot of healthy cells. Immunotherapy, the new approach, is totally different. It doesn't even target the cancer cell directly. No, it targets your immune cell. It basically flips a switch that gives your own body permission to go fight. It's a total pivot from poisoning the disease to empowering the patient. Okay, so how in the world does that actually work? Well, to get it, you have to understand a really important safety feature that's built right into your immune system. You can think of them like a set of brakes on a car. They're there for a very good reason, to stop an immune attack before it goes haywire and starts damaging your own healthy body. Let's just walk through this. Step 1, your T cells. These are the soldiers of your immune system. They get the go signal to attack something bad. But then, to keep things in check, a protein called CTLA-4 shows up. That's the brake signal. It tells the T cells, okay, that's enough, stand down. Now here's the trick. Cancer is incredibly sneaky. It learns how to hit that brake, putting the T cells to sleep so it can grow completely under the radar. And that's where Ipilimumab comes in. It's an antibody that's engineered to literally go in and block that CTLA-4 brake. It doesn't step on the gas pedal, it just takes the foot off the brake, freeing the T cells to finally do their job. And the result of just releasing that one brake, it was, and I mean this, absolutely profound. This wasn't just some cool idea in a lab anymore. It turned into a real, powerful weapon that could be used in the clinic, and it started working for a whole range of different cancers. So yeah, it had its big debut with melanoma, but it did not stop there. It's now used a lot of times with other immunotherapies to treat all sorts of advanced cancers: kidney cancer, lung cancer, liver cancer, you name it. And that just proves how central this immune system break really is to so many different types of the disease. Now, here's what's truly the game-changing part. It's not just that it works, but how long it can work. We started seeing this thing called a durable response. Because you're not just killing cancer cells, you're training the immune system. You're giving it a memory. And that means it can keep the cancer under control for years and years and years. And this leads to the most incredible outcome of all. For some of the patients who get this long-term durable response, you can think of it as a functional cure. The cancer might not be 100% gone from the body, but the immune system has it so completely locked down that it can't cause any more harm. Just a decade or two ago, that idea was pure science fiction for someone with metastatic cancer. But, and this is a really, really important but, unleashing a force this powerful inside your body, well, it's a double-edged sword. When you take the brakes off the immune system, it doesn't just go after cancer. It can get a little over-enthusiastic and start attacking healthy parts of the body too. So we're not talking about the side effects you usually associate with chemo, like losing your hair. These are a totally different class of problems called immune-related adverse events, or IRAs. And really, it's the logical downside of the drug's incredible upside. It's what happens when the immune system is put into overdrive. And these IRAs can pop up almost anywhere. Some of the most common places are the skin, causing rashes and itching, or the digestive system, which can lead to really severe diarrhea or inflammation of the colon. The liver can get inflamed. Even the glands that produce your hormones can become targets. It means patients and doctors have to be hypervigilant. Now, the good news is doctors have learned how to manage these side effects. If things get serious, they can use powerful drugs like steroids to calm that immune response back down. It's this incredible balancing act, right? You're trying to keep the immune system fired up enough to fight the cancer, but not so much that it harms the patient. So, when you put it all together, what's the real legacy here? This is so much bigger than just one more drug on the shelf. Ipilimumab truly marks a revolution in how we think about medicine.
It was the pioneer. It was the proof of concept that kicked the door down. It showed the entire world that this wild idea of releasing the brakes on the immune system wasn't just a theory. It actually worked. And its success opened the floodgates, leading directly to this entire modern age of immunotherapy we live in now.
And that kind of leaves us with one final fascinating question. Ipilimumab showed us the incredible power of releasing just one of the immune system's brakes. So if that's what releasing a single brake can do, what else is our immune system capable of? What happens next?